Good evening, everybody. My name is Dr. Matthew Holder, and I am the President-elect of the American Academy of Developmental Medicine and Dentistry. And I'm your host tonight for the Physician Education and Developmental Disabilities webinar series, presented in partnership with the Florida Center for Inclusive Communities and sponsored by the United States Department of Health and Human Services Administration on Intellectual and Developmental Disabilities and the Florida Developmental Disabilities Council, Incorporated. This is the 9th installment of our 12-part series, occurring every Tuesday night at 6 p.m. Eastern Time through October the 9th. Each part of this series is accredited by the American Academy of Family Physicians for 1 credit hour of AAFP prescribed credit and is recognized by the AMA as equivalent to 1 hour of AMA Category 1 credit. Archives of each presentation are available about 1 week after the live event at www.aadmd.org and are accredited for CME credit for the next 2 years. For those of you who are not physicians, you may also obtain a certificate of completion. Just keep in mind that we are only able to award continuing medical education credit for this webinar series. As always, toward the end of the presentation tonight, there will be some time for questions. So if you have any questions during the presentation, please feel free to type them in the question box of your control panel as you think of them. And we'll get through as many of those questions as possible during the time we have left. So tonight's presentation covers a subject that has become, I would say, increasingly more important over the past few years. Changes in the demographics of people with intellectual and developmental disabilities have ensured that soon there will be more adults than children living with intellectual and developmental disabilities, while at the same time scientific, financial, and legal pressures have made it very difficult for pediatricians to provide adequate lifelong care to patients with developmental disabilities as they age into adulthood. In other words, the days of a pediatrician following an adult patient with IDD late into their adult years is all but over. Recognizing this trend, there has been a concerted effort lately to help ease the transition of patients with IDD from the pediatric system of care into the adult system of care. And our 2 speakers tonight have extensive experience with this. Our speakers tonight are Janet Hess and Dr. David Wood. Ms. Hess is the Assistant Program Director in the Department of Pediatrics, Adolescent Medicine at the University of South Florida. As Project Director for Florida Health and Transition Services, also known as Florida HATS, Ms. Hess works with the Florida Department of Health, the Children's Medical Services, and other partners throughout the state to bridge the gap between pediatric and adult health care and to build community-based systems that support healthcare transition. Ms. Hess concurrently serves as Principal Investigator for My Healthcare, a training program funded by the Florida Developmental Disabilities Council to empower adults with intellectual or developmental disabilities to better meet their own wellness and healthcare needs through improved communication skills. As the mother of a young adult with special healthcare needs, Ms. Hess has served on many federal, state, and local advisory committees that support families and young people with disabilities or chronic healthcare needs. Our first speaker tonight is Dr. David Wood. He graduated from Harvard University in 1977 and later attended UCLA to receive both his MD and MPH degrees in 1982. He completed residencies and is boarded in pediatrics and in preventive medicine and public health. He then completed a health services research fellowship at UCLA and served on the faculty there for 7 years. Dr. Wood is concurrently a full professor of pediatrics at the University of Florida. And for over 20 years, his research and advocacy efforts have focused on improving health systems for underserved children and adults, including children and adults with intellectual and developmental disabilities. He has published more than 150 peer-reviewed publications, reports, and book chapters. And for 6 years, he has directed the Jacksonville Health and Transition Services Program, also known as JAX-HATS. Since its inception, JAX-HATS has received continuous funding from the Florida Title V program and has served approximately 1,000 youth, providing a patient-centered medical home to medically complex and developmentally disabled young adults. The JAX-HATS program has been recognized as a national model by the Maternal Child Health Bureau and the American Academy of Pediatrics. So tonight it is my pleasure to welcome both of these speakers, and now I would like to turn the presentation over to them, and I believe Dr. Wood is going first. Dr. Wood, can you hear me?
Yes, Matt, I can. Thank you.
Thank you.
Thank you very much, and I look forward to having this conversation with all of you tonight. Janet and I are really looking forward to this. This has been a great pleasure of mine since Matt did happen to include the year that I graduated from college, which was a long time ago, 35 years to be exact. So the past 6 years of working in the transition program with youth and young adults with intellectual disabilities as well as other chronic health problems has been really one of the most enjoyable of my career. And I say that just to encourage people out there who may be family medicine doctors or pediatricians or internists or other health providers. If you're not used to working with adolescents and young adults, it really is a lot more fun than challenge, I think. So I would encourage you all to take this population on and have fun taking care of them. We'd like to go through our presentation with you and give you an overview of transition issues. Many of these are issues generic to all youth, and we'll emphasize that as we talk about some of the recommendations. All youth with or without special health care needs or chronic health problems or intellectual and developmental disabilities. But in particular, we'll try to emphasize the challenges that folks with intellectual and developmental disabilities have through this period. We'll go to the next slide here. The epidemiology, and then that term special health care needs is abbreviated there. That's a term we use in pediatrics and kind of maternal child health circles to mean any special health problem. Chronic health conditions are included. Now the percentage of youth with special health care needs is as high as 18%, but 4 to 5% have what we call disabling conditions that are more complex, that include developmental and intellectual disabilities. They also include things like diabetes or cerebral palsy, which is a developmental disability, but not necessarily with intellectual disabilities, but sickle cell disease and all kinds of other health problems. But as you know, a proportion of these really have very significant physical and intellectual disabilities. Another 4 to 5% have serious mental health issues, and these populations overlap substantially. So that we think that, and then we have a 1 to 2% on SSI, which we'll talk about that when we talk about insurance and other issues as well. They qualify for SSI as children, and many of them will qualify for SSI as adults. When you combine these populations, probably around 5 to 7, maybe even higher percent of youth have really significant physical and mental health conditions that definitely need support during this period of transition. In this transition period, we'll say, goes from age around 14 is the federal start of healthcare transition. Practitioners, we're going to encourage people to even think about it earlier, but it goes up into young adulthood. It's sometimes thought of as a time, you know, when you become an adult at 18, that transition, that's when it happens. But it's really a process that happens. And these are the major goals for this period of a young person's life, is that they learn to manage their own health. And that may mean if they have a disease or a condition, that they learn how to manage their condition, take their medicines, do their therapies, and that sort of thing on their own. That they also learn to manage their own health from a preventive perspective, to practice healthy behaviors, be aware of sexuality and issues related to preventing pregnancy if they choose to be sexually active. The second bullet there is learning to appropriately use, access adult primary care, specialty services, therapies, etc. The adult healthcare system is organized quite differently than the pediatric or child-serving healthcare system. So oftentimes they have to change specialists. Not always, but almost always. And they oftentimes have to change therapists or even equipment suppliers, or the way that they get equipment and supplies may change because they go from say, a children's hospital to an adult hospital as the focus of their care. So there's learning how to access, and we put down appropriately because we want them to, part of this is not only how to make an appointment or how to get into the system, but then to keep appointments, to be timely, to be prepared for appointments, so that they can interact with the provider and get the information they need, or give the information they need to the provider so they can help make joint decisions. So there's a lot that goes into that second bullet. Oftentimes, young adolescents and young adults with intellectual disabilities have other significant complex problems, as you've heard about in prior lectures, including endocrinologic or neurologic problems, or even mental health. So they're using specialty services, and learning how to access a complex array of services is challenging for anyone in our current healthcare system. But for a young adult with intellectual disabilities, it's certainly possible, and they should be doing it. They may need some help to do that. But that's part of the goal of transition, is that they learn to do that. The other is, the third bullet there is accessing adequate and continuous health insurance. And that is a challenge, we all know. Fortunately, recently with the Affordable Care Act, insurance is more available to young people under their family insurance. Young people with intellectual and developmental disabilities, obviously there's a wide spectrum there, many of whom may qualify for SSI. And if you're on SSI in most states, certainly in Florida, or all states I think, but definitely in Florida, you can keep Medicaid insurance as an independent adult. So that's a critical issue for this population we're talking about today. But if they don't have SSI, they don't qualify for SSI, then really being ready as they hit 18, 19, and 21 when insurance changes happen, to have a plan for those and know how to keep insurance. And then the last goal is really a broader life goal of pursuing their educational and vocational goals, and we should put in their living goals. In JACSATS, we work actively with our youth to encourage them to have goals in these areas and to help support them with referrals. We'll talk a little bit about that. Because we really believe that if youth are motivated in their life in general, in their relationships, in their education, in their vocational goals, then they're going to be much more engaged in the healthcare system and be willing to learn how to become independent in the healthcare system and in their own health and healthcare, because they're becoming more independent in life in general. So we see these as really working together. On this slide, this is one of my favorite slides. It's a population model for healthcare transition. It basically shows that the population of youth and young adults is like a pyramid, with the large base of the pyramid being the general youth and young adult population. They're moving down at the bottom, and this I think I can use my pointer here. They're going from the pediatric healthcare system to the adult healthcare system on the right. So they're moving left to right on this. And what you see is that as you go from the pyramid base, which is most youth, to this pyramid, the top of the pyramid, which is really a smaller population of youth with chronic conditions, the need for supports increases. So the youth that may be generally healthy, may have mild intellectual disabilities, they may need from their pediatrician or from a nurse coordinator just some information about how to find an adult doctor and get plugged in. That's maybe all they need. However, as their health complexity increases, their need for more supports increases as well. So they may need, if they have a moderately complex condition, they may need assessment by a nurse coordinator, and then a transition plan by their primary care provider, and we'll talk a little bit about that, or by the nurse coordinator. As you go up, again, they may need more enhanced planning, more supports. The Title V program in our state, Children's Medical Services, does provide this service up through age 21. The schools provide a little bit of transition planning for vocational and sometimes health and healthcare. And so providers can get some of those services for folks that qualify for those programs through those agencies. But also providers themselves can provide enhanced planning. And kind of the top of the pyramid is the most complex, that oftentimes multiple agencies are involved and needs ongoing chronic condition care coordination and just general services care coordination. We do that in Jack's Hats because we have additional resources from the state for care coordinators. And that's needed in each region, and we don't have that available completely in Florida yet, but we're moving in that direction. This is a model that I like. It's taken from a report from the National Health Service in Great Britain, and it just again talks about the process of transition. Again, it shows the pediatric services on the left, the adult services on the right, so the person going through transition moves from left to right. It shows that here is the role of the parent, and it should be diminishing through transition. Here's the role of the youth, should be increasing responsibility during transition. And at some point there is this intersection between the parents and the youth starts to take primary responsibility for their health and health care. For people with youth with developmental and intellectual disabilities, this intersection may be shifted a little bit to a later age. Or it may never happen. They may always be dependent on their primary caretaker or parent to some degree. But we're always looking for the youth and young adult to take as much responsibility as they possibly can. So we're looking for, as the professionals, and this shows the professional pediatrician or pediatric child-serving professional providing supports during the transition with connecting structures, and then the adults services even maybe reaching in and helping out during this transition period. But we're always looking to enhance the role of the youth with adequate supports. For example, taking medications for someone with intellectual and developmental disabilities might be facilitated with a special pill holder, and maybe there actually are programs on the internet now that will text people when it's time to take their medicine. So a combination of those two supports can greatly reduce the need for supervision and medication management. So it's those sorts of things we're looking for to help youth with intellectual disabilities take responsibility for this. But one thing I really like about this cartoon is it shows it's a process, and there's a diminishing, kind of a gradual diminishing role of the caretaker and an increasing role of the youth. And in folks with developmental disabilities, this process may go on for decades. I personally have two sisters with developmental disabilities, and one of my sisters that lives with our family she grew in her ability to take manage her own conditions up to 30 and 40 years of age. So there's been a lot of discussion about this transition, mostly because young people with very serious diseases are living into adulthood that didn't used to. So the adult system of care is having to take over folks with cystic fibrosis, with ventilator-dependent, G-tube-dependent people with very severe, cerebral palsy and quadriplegic, spastic cerebral palsy, and conditions like this that didn't really, who was really fatal before achieving adulthood. So there's been a lot of discussions because the adult system really is not that well prepared to receive these folks, and frankly the pediatric system oftentimes doesn't do as good a job as we should in preparing them to become independent. So there have been task forces in both the adult side and the pediatric side. We're going to cite the task force that came out of the American Academy of Pediatrics. They did extensive work over a couple years thinking about this, and they produced what's called a clinical report in July of 2011. It provides a very nice framework and a guideline for folks, for providers to think about transition. How do you do transition is what they really wanted to tell people. It's for all youth. It's not for youth just with intellectual disabilities or chronic medical problems. It's in the context of a medical home, which really is critical to both the pediatric side of transition and the adult side. Again, adolescents and young adults with developmental disabilities very frequently have interaction with multiple specialties or multiple service providers, both in healthcare and outside of healthcare. And a medical home is critical for helping them organize that and keep things going. So this clinical report had a series of recommendations, and we're going to go through those briefly. It first of all recommended to facilitate healthcare transition that the practice maintain a list or registry of patients that need healthcare transition support. That's just basically a prompt to the practice that here's a group of patients that need a little bit of extra, and we should be putting them through kind of the paces. We should be following them in a different sort of way to make sure that we help them prepare to become independent, to transfer. And it can be a registry that of folks with your chronic disease or with intellectual and developmental disabilities. This kind of list can be built into a electronic medical record, so that like a registry in the electronic medical record, and that's becoming easier and easier. The second recommendation was that a practice on the pediatric side and on the adult side establish policies for healthcare transition. And we'll go through what these kinds of policies can look like. But basically the idea is the pediatric practice or the family medicine practice says that at a certain age we're going to transfer you, if it's a pediatric practice, we're going to transfer you to adult providers, or so that you basically make people aware of when they come into your practice that there is going to be a time when they will be transferred. It's recommended that that be posted in the office to stimulate discussion with families. Families are thinking about families of children, young children with debilitating conditions and disabling conditions are very much concerned about what's going to happen when my child becomes an adult. How am I going to foster independence in this person? Or they may be petrified of the notion of independence in their child. But I think having a policy will stimulate that discussion about, well, what can we do to help your child, whether they're 6, 10, or 12 at this time, when they're going to be 21 or 25, when they're ready to be an independent adult, how can we help them get there? The other major recommendation, or there's 6 of these, so this is the third of 6, is to encourage self-determination and independence. So the provider does that by talking to the youth and the child early on, as early as 6, 8, 10. Encourage the family and the children to take gradual responsibility for their health and health care, such as the things you can see on your screen. And some of those are more difficult and sophisticated than others. Certainly, filling a prescription is very complicated. But taking your medication and knowing what you're taking and what kinds of side effects it has, that's possible for an 8 or 10 or 12-year-old. So to encourage those sorts of things in young people and try and foster more and more independence as the person gets older in the office, which means talking directly to young people. Even having a time during your visit, even during short visits, where you spend a little bit of time alone. At what age is this appropriate? It depends on the cognitive ability of the young person. It depends on the family dynamics. It depends on a number of things. Sometimes it's awkward, especially at a time when they may become sexually active, that when the provider asks this, I need to spend time alone with your youth, it may set off alarm bells for the family wondering, oh, does he know something I don't know? So if you have a standing policy that says at age X or at a certain developmental age, we will spend time alone with the youth, it's generally recommended for a normally developing person. That could be 10, 12 years of age, and that can be adjusted for the intellectual capacity of the person. But it's encouraged that that be offered at every visit, certainly in early adolescence. Another recommendation that's a little bit more complicated and difficult for practices because they're not used to doing these sorts of things is assessing their readiness for transition. We'll talk about how to do that. That's basically trying to assess the skills that a young person needs for transition, and we're going to go over a toolkit that will help you do that, all of these things. So I'm going to skip quickly through these. One is to maintain an up-to-date healthcare summary, and that is something that we don't generally do as providers, but it's really helpful in this transition period if the family and young person can fill out a healthcare summary that they can carry around. It's very useful for people with complex medical problems to take to the emergency room if they have to go, and to take over to the adult side so the adult provider can be better prepared to assume care. The last recommendation is that the pediatrics or child-serving provider should make a very significant effort to access adult primary and specialty care providers and make a deliberate handoff when the young person and family are ready for that transition. This is more complicated than one might think because oftentimes the pediatric provider just recommends a number of different providers. You don't want to be preferentially referring or these sorts of things. And then there's another issue of insurance. There's a big barrier of insurance. We, as pediatric providers, we don't know what insurances the adult providers take on the private side, and we know very few that take Medicaid. So it gets a little complicated. So it takes some work, and maybe this is a regional issue as well, that to know which neurologists or which specialists or which primary care doctors take Florida Medicaid. And that might be quite few of them, or to find some that will be willing to accept your referrals and have kind of a handoff. So each primary care provider in the pediatric side should really be working on a network of adult providers in the regions and we'll talk a little bit about this in the state of Florida. We're working regionally, and you can consult with some of the regional coalitions around healthcare transition, and Janet Hess will talk about this later. Okay, a little bit on the kind of, if the last 6 recommendations were kind of the basics, although they're a little more, they're somewhat advanced. These are the kind of the advanced ones that I encourage you to be, if you're interested in this, to become familiar with, is to coordinate, provide more social supports during transition, coordinate linkages to community-based adult services. Pediatricians rarely know about these services because our patients are generally in school, and we don't get involved in this. But it's worth getting, the schools know about these things, or your agency for persons with developmental disability, agency for persons with disabilities, which is our agency in Florida, has these resources. Preparing them for the legal rights and responsibilities that change at 18, discussing guardianship. We'll go a little more in depth about that later. And encouraging positive social networking experiences for the teens. If you have a teen with intellectual and developmental disabilities, they will be in school full-time and up probably until the age of around 22. But there are other outside activities that are available locally through the ARC in your area or through other agencies, parent groups, advocacy groups, and you can encourage, or church groups, you can encourage social networking for this population. This is a picture of the algorithm that's in the clinical report from Pediatrics from 2011. It's a little bit hard to read, and so we're going to kind of blow it up here. But what you can see is it just basically moves from the medical home assessment of this person at age 12 or 13. That's when the process starts. That's kind of the key area. And then you basically assess what kinds of supports will they need, or what are they going to be facing when they go through this transition. You're looking down the line 4, 5, 8 years. That's hard to do sometimes with families, but it's important. Then, so you raise the issue that early on. And then subsequently at each of these 2-year increments, 14 to 15, 16, 17, 18, you want to revisit this issue during their maybe child or health maintenance visits on an annual basis. Going to the, then down, I'll go through this algorithm, but you can see that This is the algorithm for children and youth with no, for all of them, with no health problems or no chronic health problems. Then this goes into a decision point. Do they have a chronic health problem or a special health care need? And then it goes into some kind of specialized or more involved planning. All this really means is that all youth need planning, and you need to help prepare them to be independent users of the healthcare system, independent caretakers of their own health, so that they can do health maintenance, know that they have their vaccinations, know about sexual issues, and know how to prevent pregnancy and prevent sexually transmitted disease. This is really important for all youth. And then if they have special needs, they have additional needs to prepare for transition.
Dave, this is
Yeah,
Janet. Can I interject just for 1 minute? One thing that I think we ought to point out is that you know, a lot of this, especially for family practitioners, you would be following the child through all of these stages. And one of the things that this report points out is that what you're doing is transitioning, even though you're not transitioning them to necessarily another provider, from a pediatric to an adult provider, you are transitioning them from a pediatric model of care to an adult model of care. So it's not so much provider focused in these stages as it is the model of care focus, so that by age 18 or 21 or whatever your policy is, that patient has transitioned fully to an adult model of care where they're you know, managing their own healthcare needs as much as possible.
Great, thank you very much, Janet. And don't ask for interruptions next time. Just jump in. So,
okay.
Now, I want to quickly go through this. We've taken a lot of time to set this up, but you can see the algorithm and how it has this stepwise fashion. It's really health maintenance focused on transition, and then these are the decision points around special needs. I want to move quickly to this transition toolkit because it will reiterate a lot of the things that we've spent a fair amount of time kind of describing. This transition toolkit is available on the Florida HATS website and also on our JAX HATS website. Here's our JAX HATS website with the address there. I actually just looked today before the presentation, and it's not there yet. We'll be there within the next few days. It is on the Florida HATS website, and we'll show you how to access that in a minute. But that is, it will be there in a minute. So you can get into this basically this, and we're going to be showing you screenshots rather than the actual, but it's fairly representative of what the toolkit looks like. Here's the Florida HATS website, and down here where it says what's new on that website is a link to the toolkit. So we're going to take you through, and what the toolkit does is follows that algorithm basically and shows you, it gives you some tools that you can download and use in your practice. So here's the welcome screen. It has, you know, just gives a description. Here it has the login, and it's very easy, incredibly easy to create a new account. It doesn't require hardly any information except for your name and an email, and we would like to communicate any updates to you. And that's about all that's required. We don't ask for your credit card information or anything like that, so please feel free to use it. And here's the registration screen. Once you've created that account, then you can use your email and password to log in. Oh, well, this is actually the registration one. So this is the registration screen. That's all that's required. Okay, once you've registered, you will be asked, then you'll see this screen that says, you know, what are you? A medical provider, a youth or caregiver, youth and caregiver, case manager, teacher. Those basically take people through a little bit different types of algorithm, but many of the same materials are offered to those different folks, and we'll show you that in a minute here. So you would click on the medical provider, and it would take you to this screen. Now, this screen, we wanted to move through this pretty quickly, so this toolkit actually takes you question by question. You see there's each question, you go one question at a time, And I already had gone through this, and I wanted to show you that once you've gone through this, you will get these resources available to you to either download one at a time, or then you can go to a summary screen and just download them quickly. Staff in your office can do this. You don't have to do it yourself. So it can be very user-friendly. So the first question is, do you have a policy, a transition policy established in your practice or facility? And you say, if you say no, if you say yes, then it will skip it basically. If you say no, then it will offer you an opportunity, to put in your organization name, put in the age that you want the transition process to begin, and the age at which the transition process should be completed. Now again, for youth with intellectual disabilities, that might be a little bit different age, so you may leave that open. But this is a general transition policy. And I've lost my mouse for some reason, but okay. Can anybody see my mouse there? Okay, well, I've lost my mouse. I won't be able to use it, but that's okay. So then what happens is if you click on the save and continue, and it will incorporate your name and the ages into 2 policy statements. These are 2 examples of policy statements that you can use in your office. The idea is that you can take these. One is a little more wordy than the other. The first top one has as basically a statement about how the model of care changes for young adults 18 and over, so you can take one or both of these and download them as a PDF or download them as a Word document, put it into a document that with your practice logo, edit them as you like, and then you have your practice policy. And again, the idea, the power of this policy is to post it, stimulate discussion, so that everyone's encouraged to start to plan for transition. So we'll go on to the next one, and this is where you download the policy statement. Next one is a checklist or a method to help patients through the transition process. And most people don't have these kinds of checklists. So this is like a well-child checklist, just to make sure you cover all the bases. We're going to zip through this pretty quickly because I want to make sure Janet has time. So the checklist is on there. It's in a PDF format. It's a fairly complex document. You can see this is the whole page there. It has tasks broken down by age, from tasks that you want to do early on to tasks that you want to do early and middle kind of the process, and then prior to the 18th birthday. And then some things you want to cover beyond 18. So this gives you a nice task list. The thing about this, and we'll go through each of these different things, is there are resources on the Florida HATS website that give you information about each of these. So if there's something in here that we're describing that you don't know about, then you or your staff could go into our Florida HATS website or our Jack's HATS website and look up these materials. This basically gives you a checklist where you can say when you discussed it, and if you're convinced they learned the skill, you can check it off by then. This one in the middle, I should say early adolescence, you're just introducing them to these things. You're encouraging them to take responsibility, knowing about their disease. In the middle and late adolescence, you are encouraging them to take more responsibility, be thinking about transition, trying to keep their own health record or paperwork, really start to take more active responsibility in their health care. And then prior to 18, you want to make sure that they do know about their insurance coverage, how it might change, SSI and how that might change, guardianship. And we'll go a little bit into that. After 18, again, reiterating a lot of these things because they continue to be issues: guardianship, Medicaid benefits, work, vocational, and other opportunities. So there's a lot of things here that you might not know that much about, but we do again have these resources on the website, and I encourage you to look them up. Portable health summaries. This is the next phase, and this is one of the recommendations. I would encourage you to think about this. It's not something we do routinely, but then again, you can say that you don't have a portable health summary. It will present you with these 3 options for the health summaries. These go from pretty sophisticated health summaries that we as doctors might use to a very basic health summary that the patient themselves can fill out. And they're kind of complementary, so you might want to actually have all of them there and show them to families. And it's a good exercise for them to fill this out on their own and bring it back at another visit. Here is an example of kind of a more medically oriented health summary that shows you, gives you their insurance information, allergies, the main diagnoses, their medications, their current therapies. On the back, it actually has when and they've had surgeries and that sort of thing. So this can be a very nice summary that you could help them fill out, and they could take it to the adult doctor, and the adult doctor would feel like they had a good summary of what's going on. This is a very user-friendly kind of patient-oriented health summary that allows them to put in the things that they're concerned about, how they want to be talked to, what they're concerned about in their communication style or their vocational goals and objectives, their life goals. So this is helpful too for a provider to get a real good understanding of where a person stands with regard to their intellectual abilities and their life goals so that they can support them. Again, you can give these out to the patient, have them fill them out, and bring them back the next visit. It doesn't take but a minute to do that. This is a transition readiness assessment tool as a next step. This is a tool we've developed. It's a bunch of questions here, but it really covers the basic issues of what one needs to transition. And I'm running out of time. I want to move on. But you can give this to people in your office. They can check out whether they know how to do these things, and it can be a nice survey that your nurse or MA can do, and then you can know what to work on with them to prepare them for transition. I want to skip through this. And then I want to switch to Janet Hess to go over some of the resources that are available in the toolkit and on the Florida Hat's website. Did I go back?
Okay.
Sorry.
That's fine. That's great. Okay, so here's the last question under the medical provider module, and this really is just asking what is the full age ranges of your patients. Do you see patients as young as 12 and as old as 18 or older? And the reason is that you will identify those patient categories, and the screen comes up then with resources for patients by age group. So you've got your resources for the younger age group. These are the checklists that Dr. Wood just went through. A typical item on that checklist might be to begin spending time and asking questions at each doctor's visit. The resources for the 15 to 17-year-olds, by this time, they should be spending the majority of their time with the doctor. They should be taking much more responsibility in managing medications. And then you can see that we've got resources for patients 18 and older, as well as some general educational materials that talk about transition generally rather than by age. The 10 steps to successful transition is a nice handout. I'll show that to you in a minute. We've got a couple of pieces of materials that were developed by Dr. John Rice at University of Florida, the Institute for Child Health Policy, that are just exceptional. And then some specific information about things like Social Security, SSI, guardianship, decision making. So here are some of the examples of materials that you can just link to and download. As you might know, at age 18, one of the big changes, there are a lot of changes that happen at 18, but one of the big changes for young people with disabilities is that they have to reapply for SSI. And so this handout just kind of goes through the steps in an FAQ format and identifies the things that need to happen during that reapplication process. The 10 steps to successful healthcare transition. This is just kind of like a book rack marker that you can hand out. It's English on one side, Spanish on the other side, and you can just see a lot of the items and and steps that we've talked about through this presentation are listed here. We also have this available in Haitian Creole on the website. One of our materials is this information on health insurance. It's called Just the Facts, the 411 and Health Insurance for Young Adults ages 18 to 30. And this is like a, I think, 70-page booklet that goes through all of the options that are available to young Floridians, both with and without disabilities, from private insurance to public insurance, to no insurance, what's available in safety net plans and communities. So it's very comprehensive, and we've gotten a huge amount of response about how valuable this is as a tool, not only for young adults ages 18 to 30, but we really outline insurance options for younger children and older adults as well. And then this is a nice little diagram of the inverted pyramid that shows the decision-making process and how there are many options in a continuum as you look at decision-making, particularly for people with intellectual disabilities and developmental disabilities, going from at the bottom having all the control and moving up the pyramid so that you gradually have an authorized representative making more decisions for the person, for the individual, all the way to the top where you've got full guardianship. And you know, a lot of people aren't familiar with all of these options and don't know that there are different stages and different steps along the way. It's not either or, it's a lot of options in between, just based on that person's abilities. These are the materials that are available from the Institute for Child Health Policy. They're just exceptional. The Envisioning My Future is a very comprehensive book. It goes over all of these checklists and skills from 12, starting at 12, all the way up through 18 plus. So it's not only for a specific age category. You can see the When You're 18 is a very nice brochure as well. And then this is the final screen. In a minute, I'll show you the way that your toolkit is organized. You see on the right-hand side the additional resources, and one is, again, this clinical report that shows the recommendations from the AAP, you know, starting with the transition process at 12, moving it up to an adult model of care by ages 18 to 21. And then one of the things which Dave had pointed out earlier, while this piece of the algorithm is focused on all young people, we move into those that have special health care needs or chronic conditions. And what we've done is kind of built on this algorithm format and structure and shown you through this visual representation the steps that we've outlined in terms of identifying at these various age brackets and age points, what are the kinds of special referrals and services that young folks need that have special healthcare needs, disabilities. At age 12 to 14, you want to make sure that you're looking at whether they have an IEP, whether they're clients of the Agency for Persons with Disability, again, looking at guardianship as they get older, and it moves through all of the age brackets and then comes back out to, you know, have all these issues been addressed. So it's really kind of a full circle algorithm that enhances the report that was produced by the AAP. So this is the screen that pops up at the very end of the toolkit. You can see where, you know, you've answered the questions, and the resources that have been made available are there for you to download. And let's see. So we talked a little bit about Florida hats. Obviously, in putting together the toolkit, we really had to identify, and highlight just a few of the resources that are available. But as Dr. Wood mentioned, there are all kinds of additional resources available on the Florida Hats website. So this is the logo and the web address. This is one of the screenshots, and as you can see, if you look down the navigation bar, you've got a toolbox for healthcare providers. This is the page for healthcare providers, and it has all of the information that we've already gone through and shown you, as well as lots of condition-specific, age-specific checklists, summary forms, assessments. So there's just a lot of information available. And then, as you can see again on the toolbox, if you want to find out more about guardianship or decision making, if you want to find out more about insurance or advocacy, you can click and go into any of those web pages. We've also started a series of briefs. These are 1 to 2 page information sheets or fact sheets about specific topics and resources that are important during the transition process, again falling under these enhanced services that many young people need. This first one is on health insurance, and we talk about our guide and some of the major points there. We just finished a second one on vocational rehabilitation and the services they provide and how healthcare providers play a role in the transition from school to employment. So these will be coming out regularly and are just a nice brief overview of some of the resources and services. This is a 4-hour web-based training for a broad range of healthcare providers, available for CME credit. This was also developed by Dr. Rice at the University of Florida. It is available through the Florida AHEC, and goes into a lot more detail about the history of transition, the Maternal and Child Health Bureau, and then into more detail about all of these topics and content areas that we've just discussed. And then this is just a snapshot of the Florida Hats brochure that talks about what the organization is about and what we do. And that's also available to download in English, Spanish, and Haitian Creole. So I think that brings us to the end. Matt, did you want to?
Yes. Well, thank you so much, David and Janet. What a great presentation and an amazing toolkit there. I do have a couple of questions that have come through. First, I guess, could you put it on the last slide there, just so I can give everybody the information here on how to get your CME certificate? Thank you. If anybody needs to get your CME certificate, you can just go to the website there on the screen. That's www.bitly.com/PEDD 2012. And from there, you just sign in and register, or register if you aren't already registered. If you haven't registered and you are registering for the first time, you will get an automatic confirmation email. Just make sure that you check your spam folder if you don't receive one of those emails, because it may get caught in a spam folder. If you do have any issues with getting onto that system, then you can go to aadmd.org and hit the contact button, and one of us will be contacted, and we'll try to work through whatever technological issues we're having. Once you're logged in onto that site, you can complete the survey about this particular webinar, and you can take your quiz, and if you get a 7 out of 10, that is a passing score, and at that point a certificate of completion will be displayed and automatically emailed to you. So let me ask a couple of questions that came up. First off, I guess starting very broadly here, we do have a few viewers from outside of Florida, and they were wondering if you have to be in Florida to use the Florida Hats Toolkit.
No, you don't. It's on the web. You can and this is a lot of these materials included in the web and the toolkit have been developed outside of Florida. So absolutely not encourage anybody in the United States or in the world to use that.
Yeah.
Excellent.
Yeah, and while a lot of the resources have been adapted for Florida, you know, a lot of the issues don't vary too much state by state, so they're very applicable, you know, generally.
That was actually the second question that I had was whether this was specific to the state of Florida or universal, and it sounds like most of these materials are fairly universal and can be applied in a number of ways outside of the state.
Yes.
That's great. Now, I guess a couple of questions we had. What has been your experience with people with youth with intellectual developmental disabilities in assuming more responsibility for their health care over time with a program like this?
You know, this is Dave. I think it obviously varies kind of by 3 or 4 different parameters. One parameter would be the intellectual capabilities of the person themselves. So that needs to be assessed. That's a complicated assessment, actually. I think oftentimes it's helpful to actually go through some of these activities and see if, and a little bit of trial and error, see if a person can manage their own medicines with some help, and see if the parents will back off, and they might be surprised at their ability to do some of these things with maybe some supervision, but perhaps achieving full independence. So I think it's really, that's an important aspect. The other aspect too, of course, is the complexity of the task. So some things are very complex, knowing about specific medication complications or calling into a complex system and making an appointment. But again, trying to provide concrete advice and guidance, I think a lot of independence can be achieved by many, the majority of folks with intellectual disabilities. Now, another parameter is the family's willingness to engage and to do this, and this may take some coaching, encouragement. Some families are very anxious for their their child and then their adolescent and then a young adult to become independent, and some are really afraid of that and afraid of them taking the bus, or afraid of them being exposed to, you know, some of the risks in the world today. So, or they may have, you know, I have a number of patients with other conditions like diabetes, and to allow them to have some independence and freedom, there is risk involved. So I think acknowledging that risk and putting it out there and seeing how the families react is part of the process. And that's one reason why to start early, having them think about it years in advance when it's not threatening them, it's not really imminently a threat to their kind of the way they do things, so they can plan that. I think that's a very important consideration.
Okay, thank you. Now, from a practice standpoint, what are some of the common challenges that maybe a practice might have in implementing this program if they've never done anything like this before?
Well, I think one of the challenges is I'll say as a provider, and then Janet can respond. But I think one of the challenges is that oftentimes as practices we're not set up to do this kind of health maintenance. It's a different set of activities, and you have to organize your practice just like you do for health maintenance or just like you do for immunizations. You have to have the forms on hand. You have to be ready to address these things during maybe the health maintenance visit. Practices are very busy, but these are issues targeting adolescents, when we really encourage people to take a little extra time with them. But it does mean that the providers need, and support staff need to have an organization around these issues and feeling comfortable talking about these things. I think the best way to do that, it's how I learned, is you just start talking about them, and you say, if you don't know something, let's look it up together. now there's enough resources out there that you can look it up together, and maybe even parents will teach us how to do this. So I think, practice, organization, and structure, as well as some of the content, becoming familiar with it, are the two big challenges.
Yeah, and I would agree. I mean, I think there's inherent challenges with serving people with intellectual disabilities that are very different from other patient populations, but certainly serving children, youth, and young adults with special healthcare needs does take a lot of coordination. Care coordination support, seems to be the biggest issue when you've got these young people with complex needs. Knowing the resources to be able to refer them to in the community, knowing the other agencies and what they do and how they can help support the healthcare self-management skills and the self-reliance goals and independent living goals. And then an underutilized, probably an underutilized resource is children's medical services. Each of the offices, the regional offices, have transition specialists and care coordinators, nurse coordinators for children with special healthcare needs, and so they can become a support in a lot of these care coordination activities.
And I have a question about health promotion messaging and materials. In these materials, are there specific goals or programs around health promotion type activities and transitioning, I guess, into taking responsibility from a health promotion standpoint, like smoking and nutrition and those kinds of things?
Those are. Go ahead, Janet.
Oh, I was going to say that the focus on most of these materials are on health care management, self-management, as opposed to healthy lifestyles. Not that that's not an important part, but we've focused more on the healthcare aspect of it.
Okay.
And there are more and more. There are materials, and we have them on the Florida Hats website. Some of them about taking responsibility for your health. There are some materials that are for young adults with developmental disabilities, and I think, Janet, you've been working with some on the self-advocacy project. And
right. It just separately, although it's not really separately, in another project that's funded by the Florida Developmental Disabilities Council, we are piloting a curriculum that is targeting young adults with intellectual and developmental disabilities, to help them learn communication skills for their healthcare in their healthcare encounters. So we're excited about this, and it really does complement a lot of what we're talking about here, because it's encouraging and teaching the skills that these young people need to be able to be more independent in managing all of these activities.
Yeah, there's no doubt about that. I think we've had earlier in this series we had a couple of topics on communication and how important that is, and by no coincidence was the topics of self-determination and communication sort of tied together, because of how important it is for one's own self-advocacy to be able to effectively communicate, or at least to communicate better. I'm familiar with this project, and I think that it is going to add some very unique tools to this, but it certainly is a very important piece of the transition program.
And actually, one of the cornerstones of this new curriculum comes out of Dr. Rice's work. We use the GLAD moniker: give, listen, act, decide, and do. And it's just an easy way to remember the different things that need to happen during healthcare encounters. So so far it's going well.
Great. And you know, I guess we had one other question, very to the point. I don't know that there's actually a really good answer for this, but the question was, how do you know when you're there? And I guess that really interpreting that is, how do you know when you've successfully transitioned somebody and you can say, okay, you are ready?
Well, that's part of the transition assessment. It's it's a clinical assessment, but there's also the transition readiness assessment questionnaire, which I zipped through because we were getting short on time. But it does have questions that cover the full range of skills, and I think that one can be pretty comfortable that if you are covering all the skills on that transition readiness assessment questionnaire, they're pretty close to being ready for transition. So it's really like a developmental assessment, which is complicated, right? So we need tools to help us with these developmental assessments, and but it's assessing their skills and making appointments, managing their medicines, those sorts of things, and knowing about their insurance. So those sorts of things, when you feel like they're doing these consistently over time, and they're plugged in. Some of the one last thing I'll mention is transition is not just about the individual skill set, but it's the system itself. And so we find that even people that are ready for transition, sometimes the adult system, there's a lot of cracks, so they fall through. And I jokingly talk about our clinic as the crack clinic. We're a crack prevention clinic because we want to prevent them from falling through cracks. And so we, if you know that getting into an adult neurologist is really difficult in your community, if you're on Medicaid, that might be something you work with the family on, even when they're capable and ready to advocate for themselves. So some of it has to do with the system as well as the individual.
All right. Well, Dr. Wood, Ms. Hess, thank you very much for a great presentation tonight. Really appreciate it, and it's great work that you're doing with the transition program that you have. For our audience, please remember that in order to get your CME certificate, you must go to the website that's on the screen. And if you have any questions or concerns, you can email me at mattholder, all one word, at aadmd.org. And please join us next Tuesday night at 6 p.m. Eastern Time for our presentation on improving practice quality and identifying quality resources. So see you then, and thank you from all of us at the AADMD. Have a good night.
Thank you. Good night.
Thank you.